Hi, I'm Lexi. I've been a registered nurse for 10 years and I've been working at the Skin Center for a little over 5.
Hi, I'm Rachel. I'm a registered nurse for over 20 years, and I've been injecting at the Skin Center for the last 6 years. And we've been working together at the Skin Center in Shadyside for over
5 years now.
Okay, yeah.
Yeah.
Generally, I think people come in and they say, "What does Botox do?" I tell them it temporarily relaxes the muscle. It prevents lines from forming. We can also help the lines that are already there. We can make them softer. We can make you look more refreshed and just kind of soften the appearance of them.
There are different types of neurotoxins. I have a patient come in and they say, "Hey, I want Botox." And I think that that is that big brand out there and maybe they're unaware that we have multiple types of neurotoxin out there. I like to give the analogy of tissue. That big box name is Kleenex, but there are different types of tissue out there, all different kinds. So that's kind of the same as neurotoxin, where there's different types of neurotoxin: Botox, Dysport, Daxify. It's typically, what we carry at the Skin Center and what we like to use.
Yeah, I agree. Is there a specific one that you like right from the get-go recommend to your patients specifically?
I typically like to do something that's going to last about 3 to 4 months just to see, hey, are you going to like this? There's different neurotoxins that will last longer. But, typically Botox, Dysport is what I'm kind of grabbing for that initial patient that has never had it before.
I feel like some of my patients request Botox most often because that's what's out there. I mean, they're hearing the other types of neurotoxins now, but they're requesting Botox the most because they feel safest with it because it's been around the longest. They want to know why use one versus the other. There's no scientific data to support that one works better than the other. It's which one works best for you. And it's kind of like trial and error. We're figuring that out. We're getting to learn your face, your anatomy, your muscles. They're all generally doing the same thing, but the properties of the products are a little bit different. Some are made with a protein, some are made with a peptide that can help your skin. So there's benefits for everyone, but the difference is I feel like the onset, the duration, the way they're going to last in somebody's body is going to be a little bit different.
Right.
It's also based on their metabolism too.
And I think it is all trial and error. I have some patients come in and they're runners and we try a certain neurotoxin and maybe their body kind of burns through it a little quicker. So we just use a new one and kind of see how that is. In my opinion, I feel like what makes an average Botox result turn into a great Botox result would be doing a full face assessment and really targeting the entire face and not just chasing a line that someone's concerned about, kind of taking a step back and looking at the bigger picture.
I totally agree. I also think like the treatment that makes it go from like good to great is one that really goes under the radar. People don't want other people knowing that they've had a Botox treatment. So I think like they want you to tell them and compliment them like, "Oh my gosh, what are you doing? What kind of makeup are you using? What skincare are you using? Your face looks so good." Yeah, you just want that natural, refreshed look. So I think the difference between a good and a great one is just someone feeling like they're, their best version of themselves.
So typically when a patient comes in, what are the first areas that you're treating?
I do talk about the most FDA approved areas, especially with Botox. I feel like that's an easy way to explain it. 64 units, and that's treating the glabella, the crow's feet, and the frontalis.
And they recently just FDA approved the platysmal band area.
A lot of my patients ask me, like, what does the FDA approval process mean? And it's really just, it's a drug that goes through the FDA approval process for a specific area. They come up with numbers that work for that particular area in the face. Dose equals duration. So they've, filtered out that process to come up with the perfect dose for those specific areas.
Right. And I think it's really important that I educate my patients that, when we are injecting you, this is a medication. So if you are underdosed, then you're not going to get that longevity out of it.
And no two face is the same. Two
Right.
patients come in at the same age, wanting the same treatment.
Right.
The dose is going to be a little bit different.
Yeah. You always you have that patient kind of come in and say, "Hey, so my friend got 30 units, so I want 30 units.
Right.
And that's not always the case.
Yeah.
Your muscles are different than mine and my dose is different than yours.
Yeah. Just coming up with every plan has to be customized to that individual. Yeah.
Exactly. So I think it's so important. And I always stress to my new patients that we do need a 2-week follow-up just because it's going to be fully kicked in, that neurotoxin, in 2 weeks. So if we do need to add any units to your treatment plan, that's when we'll do it.
I agree. I'm always telling them we're coming up with the perfect recipe for your muscles.
Right.
That first encounter, we're getting to know your face, reassessing in 2 weeks to see what we need to add to, or maybe we got it right on the first time, but it's so important. I agree. I explain it to patients that it does take that full 2 weeks for it to fully kick in. I say that you start to see a difference after 3 to 5 days, but give it that full 2 weeks for that to fully relax that muscle and then come in for that reassessment.
And different neurotoxins have different onsets. So I love that, Daxxify takes sometimes 24 to 48 hours to kick in.
Very next day.
But your Botox and your Dysport are taking a little bit longer, those 3 to 5 days to start to settle in.
I think it's so important to set that expectation and that consultation up front at first so they are just properly educated so they know what to expect. I mean, when I go into a doctor's appointment, I want to know what to expect.
So we tell people to come in for their 2-week follow-up. When should we tell them to come in next?
I tell them to come in, you should be treated every 3 to 4 months consistently, for the best possible outcome. But ultimately, it's up to them. It's what they're comfortable with. So if they stretch it a little bit longer, that's okay. Whatever fits your life, your budget, whatever works best for you. But typically, that's what I tell my patients.
So typically, when I explain to my patients how that Botox is working and how the life cycle is, it's fully kicked in that 2 weeks. It looks at its best, I would say, about a month in.
I agree.
And then around 2.5 months, we're starting to get a little bit of slight movement back. And then about 3, sometimes 4 months, we're back to that baseline. And I kind of leave it up to my patient. I have some patients who they're in my chair at that 3-month mark on the dot. Then I have some who, maybe around the 4 months, and that's okay. I kind of make it customizable to my patients.
I often have patients ask me if they wait longer, like if I don't get back into your chair for 8 months, am I going to need more the next time I'm there? What do you tell them?
I always say, sometimes, you're getting that movement back on the muscle, and just like, your biceps, your muscles can regrow strength. So yeah, your dose may need to change. Or, if a patient gets pregnant and hey, they haven't seen you in 2 years, your dose is going to change. Your muscles regain that strength again. They're kind of pumping again and contracting. So your dose will change. So I like to see them back 2 weeks post that initial dose after pregnancy and breastfeeding.
I agree. Education is key. So all that upfront information, I think is just so important for patients.
So what does movement mean to you? Because I feel like as injectors, it's so objective to us what movement is, but to the patient, it's really subjective. And sometimes I feel like they look at movement, the slightest movement, and say, oh, well, I have a little bit of movement at 2.5 months, but that is normal.
It is normal. I mean, it's a muscle. It's a medication. It's going to wear off. So I think depending on when I'm seeing them back, if they are back in our chair at that 3 to 4 month mark, I'm looking at them and I'm like, is this normal? This is normal movement at this point in your treatment plan, and we're just ready to retreat. So I think just finding that balance of depending on where we're seeing you in your process and figuring out, when did it start wearing off? What is exactly going on? So we're trying to figure out what we're going to do next.
Yeah, you kind of have to be a little investigator in what happened. And
was this in 4 weeks? Was this at 8 weeks? Next time keep track for me because we want you to be happy. We want this to last you.
And then typically, if they're not getting that longevity out of it, you just tweak their dose a little bit. That's all.
And sometimes, honestly, I switch up a product. Everybody's different. So I feel like, every product works a little bit different in your metabolism. We don't know until we try. So if we've given Botox a few opportunities to do what it needs to do, you haven't been happy, let's move on to something else.
Yeah, and it's good to give your body a little switch up. Sometimes if you've been on Botox for a couple years, let's do a little Dysport, change up the protein and kind of see how your body likes that. You can always go back to Botox or Daxxify, but just doing something a little different and seeing how you like that.
So when a patient comes in, what are you typically asking them to say? How much movement do you want? Because I feel like oftentimes I will have some patients that come in the door and they'll say, I want my forehead completely frozen. How are you responding to that?
I feel like educating is the best thing for the patient. You say, I always tell my patients, I can always add, but I can't take it away. So I would rather dose you conservative today, learn your muscles, and then in 2 weeks, we'll add the units and make sure your dose is perfect. That's going to last you that full 3 to 4 months.
Typically, I honestly give my patients a mirror. I have them hold the mirror and then we go through area by area, like what bothers you the most? And like, let's focus on that area. And then I go through each area looking in the mirror of like, how can I help you?
Right.
Kind of like coming up with that customized plan, and then keeping things conservative and natural, like you were saying.
What do you typically do if a patient says, okay, I just want to target my forehead lines, but as an injector that we also need to inject other areas to help offset and balance the face.
I talk about balance. Like again, bring it back to the mirror, going through each area, how those muscles work, explain that some areas are lifting muscles, and kind of going through that these two areas are paired together and just going back to that balance of the face. We touched on a lot in part 1.
Yeah. Join us for part 2.